Doing a show about the WHO. That's right, folks. Declared a monkeypox global health emergency. We're fucked, folks. How many times do I need to get on my show? Right? How many times do I need to sit down at my desk and yell at a bunch of stupid motherfuckers? Right? Because, you know, like, okay, so we had the COVID pandemic, which is still happening. We decided, you know what? Let's do nothing. Right? Let's do nothing. We tried nothing. Didn't go so well. So then we have the monkeypox epidemic. We're using the COVID blueprint of do nothing. Let's just analyze this, sit back and do nothing. And now what do you oh, whoa, global health emergency. Okay. Wow. Like, again, it's like being surprised. Look at this. I got this Team AOC pin. It's like being surprised. If I let go of this, it'll fall onto my desk and make a noise. Oh my god! Right? It's called cause and effect. You do nothing to prevent the spread of a disease, and then the disease spreads. Whoa. Holy shit. So, you know, so we tried doing nothing. I already said that. For the second time in 2 years, the World Health Organization has taken the extraordinary step of declaring a global health emergency. This time the cause is monkeypox, which has spread in just a few weeks to dozens of countries and infected tens of thousands of people. Dr. Tedros Adhanom Ghebreyesus, the WHO's Director General, on Saturday overruled a panel of advisors who could not come to a consensus and declared a public health emergency of international concern, a designation the WHO currently uses to describe only two diseases, COVID-19 and polio, which, by the way, polio's back in New York. RIP. We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little, and which meets the criteria for a public health emergency, Dr. Tedros told reporters. The committee's inability to come to a consensus also highlights the need for a better process to decide which events represent public health emergencies. It is apparently the first time the Director General has overruled his advisors to declare a public health emergency. Quote, the process demonstrates once again that this vital tool needs to be sharpened to make it more effective. Okay, but counterpoint. What does declaring a public health emergency do? It does nothing. So we're like, oh shit, there's a public health emergency. Is Joe Biden gonna do anything? Joe Biden's gonna be like, oh shit, a health emergency. Is the Democratic Party gonna do anything? Oh fuck, WHO health emergency. Is the Republican Party gonna do? Oh shit! Oh, they declared an emergency. Does nothing, right? So if we're talking about sharpening the tools, if we're talking about tool sharpening, what we need to do is I don't know, maybe get some legislation going so that if an organization like the WHO declares a public health emergency, that we have automatic triggers that would affect that kind of stuff. Like, you know, maybe do some moderate stuff like mask mandates. Maybe, I don't know. So, again, I'm just saying, like, this country, I mean, most countries, but this country, the U.S., whew, pretty fucking stupid. The WHO's declaration signals a public health risk requiring a coordinated international response. Good luck with that! Good luck with that, okay. The designation can lead... You know, I just had an idea. What if we had, like, an agency in this country, like in the U.S., where, like, like, you know, like the EPA, right? They have that agency where it's like, oh, we want clean water, and the EPA will do that. Well, I mean, not anymore because of the Supreme Court. But anyway, what if in this country we had an agency that was like, it controls the spread of disease? Wouldn't that be a good idea? And maybe we could, I don't know, authorize this agency to prevent the spread of disease. Wouldn't that be a good idea? Anyway, like, think about this. I just had this great idea just now. Just came up with it. Disease control and prevention. I don't know. There's something there. There's a there. Maybe we can look into this. Anyway, the designation can lead member countries to invest significant resources in controlling an outbreak, draw more funding to the response, and encourage nations to share vaccines, treatment, and other key resources for containing the outbreak. Oh, right! Sharing vaccines, just like the United States did with COVID, right? Remember when they shared the vaccines to the global south and to Africa? Oh, right. They didn't. I forgot. It is the 7th public health emergency since 2007. The COVID pandemic, of course, was the most recent. Some global health experts have criticized the WHO's criteria for declaring such emergencies as opaque and inconsistent. At a meeting in June, WHO's advisors concluded that while monkeypox was a growing threat, it was not yet an international emergency. The panel could not reach a decision on Thursday, Dr. Tedros said. Many experts roundly criticized the process as short-sighted and overly cautious. Oh, overly cautious. Oh, really? Well, we were underly cautious when it came to COVID. And now look, we got 1 million motherfuckers dead in this country alone. So, I don't know. I think we're all in this country, we're all learning the wrong lessons. That's my thing. I think most Americans are fucking stupid. All politicians, except for like 5 or 6, are pretty fucking dumb, right? And as a country, we're like 2 + 2 = 6, and then we're just gonna keep grinding that in. 2 + 2 = 6. 2 + 2 = 6. 2 + 2 = 6. Oh shit! Public health emergency. Let's do nothing. Let's pray. Thoughts and prayers. Let's pray. That's what we do in this country. Anyway, you can read the rest of this if you'd like. But it's a global health emergency. My opinion is better safe than fucking sorry. When it comes to any disease, right? Better safe than fucking sorry. Like, I'm not going out there licking telephone poles. I don't want to get fucking diseases, motherfucker. I'm not sharing needles. I'm not drinking after people, right? Like, so I'm just saying, better safe than motherfucking sorry. So I'm just throwing that out there. But again, I feel like we're entering an era where health is going to be a big deal in the future. We have these unregulated and poorly regulated meat markets that basically produce all kinds of diseases all over the country, right? People are extremely unhealthy. People are immunocompromised by default. Again, 95% of Americans don't eat vegetables. 93% of Americans are cardiometabolically unhealthy, right? Our bodies in this country are not designed to fight off diseases, right? So there's going to be disease after disease after disease. They're all going to fucking destroy our immune systems, and we're all going to fucking die. That's my prediction. And I don't know, because I predicted the same thing a couple years ago, and that was before we had a million dead motherfuckers. Now we got 1 million dead motherfuckers, we got another disease on the horizon, and we're not doing anything. So, I don't know, man. So far, I'm pretty spot on in my analysis, but we'll see in the future. Anyway, monkeypox, folks. Hell yeah.